Hey there, thanks so much for joining me here on Wave Now's Ask the Doc segment. I'm Myron, sorry. So we are back in school for the kiddos. So I don't know about you, but I know that that is about the time when kids start coming home. They've got the sniffles, they're not feeling well, or you're getting that phone call to come pick up your kid. And that just kind of throws everything out of whack for all of us because none of us want to deal with that because some of these things that are floating around right now, they are contagious. So we wanted to team up with Norton Children's Medical Group, Dr. Heather Felton today, to talk about what types of illnesses that we're seeing floating around right now. Dr. Felton, thanks so much for talking with us. What are you seeing a lot of right now?
A little bit of everything, really. So it's very typical every year when children go back into school, they start mixing in with each other again. We see an increase in all types of different infections. I'm seeing viral infections, but also bacterial infections like strep.
So, a lot of these things that are going around right now, they're pretty contagious. You're seeing, we're also talking about COVID. We are not done with that. And I know people kind of get frustrated not wanting to hear anything about it, but we do need to talk about it because that's going around. And then another one, even that's touched our Wave family here, one of my managers, her kid has pink eye. So, things are kind of going around right now.
Yes, I've seen influenza. I have seen RSV, which is respiratory syncytial virus. I've seen some COVID, which I didn't see much of all summer long. But as soon as kids are with each other again, they're sharing utensils and school supplies, playground equipment, you're going to see an increase in all of these different types of infections.
So a lot of this can be stopped with, proper hygiene. We've talked about it, but also if you're not feeling well, then kind of take a step back and maybe stay at home.
Absolutely. So the things that I talk about when I talk to my patients about preventing infections is a good healthy diet, making sure that you're sleeping well, that'll help to keep your body strong. And then good hand hygiene is very important and it can be really difficult, especially for young children, not touching your nose, mouth, face, not rubbing your eyes, like you mentioned, the pink eye, covering your mouth when you cough. And yeah, if your child is sick, if they've had a fever, if they're not feeling well, it's better to stay home until at least the fever is resolved for 24 hours and their symptoms are starting to improve because you don't want to push them too hard and you don't want to risk getting somebody else sick.
So we talked about, you mentioned a couple of things, RSV, a little bit of flu. We're already seeing it already.
We've seen a few cases of flu, and I have seen it also in children who have come back to the United States after traveling outside of the country over the summer. They've been flu types A and B. It's been kind of interesting. Another thing that happened during the pandemic was that some of the other respiratory infections seemed to get a little bit confused about when their season was anymore because COVID really overtook everything for so long that, usually we think of RSV and flu as not starting until October or November. But I remember this time last year, I was already seeing RSV and I'm already seeing it again this year. And so I don't know if it'll be like this always, but at least for right now, I'm already starting to see some of these respiratory infections that typically didn't appear quite so early.
And with pink eye, which is also going around, that is really contagious. Talk to me about pink eye.
There are two types that are contagious. So you can have bacterial conjunctivitis, which conjunctivitis is just a fancy way of saying an infection in the eye. But it can also be viral. The bacterial type would need drops or medications. The viral type will get better on its own, but they're still contagious and mostly from touching something that has the germs on it and then touching your eye, which spreads the infection there is something called allergic conjunctivitis. So this is also the season of hay fever and ragweed, and so you can have itchy, very watery discharge from the eye, but they can still be pink, but that might be an allergic cause, and that treatment is also different. So my advice would be is that if you have a child who has pink eyes with some discharge, go ahead and see your doctor and see if they can determine what the cause is.
And with some of these things that are going around, you talk about strep, flu, COVID, a lot of it is kind of like you may not know what you're dealing with, right? Because the symptoms are all very similar. They run into each other.
Yes, so a lot of these viral upper respiratory infections may have a little bit of fever, cough, congestion, runny nose, and so they can all look very similar. And these are all viral infections. And so there isn't necessarily a specific treatment for them. And so not everybody will necessarily need a test if it's not going to change what you're going to do. Now, if you're looking for isolation guidelines for COVID, for example, you would need a test to determine if we think that it's COVID versus some other type of infection. If you are wanting a medication like Tamiflu to help shorten the duration of flu symptoms, you would need a test to determine that that's what you were talking about. And sometimes I use a test for RSV in order to give guidance to my families, especially parents of infants, because we can kind of predict what a typical cycle of RSV is going to look like for them. So there are cases where it can be really beneficial to have some treatment or some testing, I'm sorry, but not always. And so the treatment is usually supportive, rest, hydration, Tylenol or ibuprofen to treat pain or fever, and just making them comfortable, and it will get better on its own.
So this is kind of just comes with the territory of the time of year that we're in, back to school, kind of entering fall and ending summer, and we're back together. A lot of folks are probably sick of it, I know, but we've talked about masks. Should we mask up again? What do you think?
Masking can be helpful. And so I think that, I wear a mask in my office. If I'm going in to see a patient who is coming in with fever, cough, congestion, I don't want to get sick and I don't want to bring it home to my family. So I would wear a mask going in. If I were unsure, let's say I had a little cough and I wasn't sure if it was allergies or maybe I was starting to come down with something, I would probably wear a mask then too. And I would do it if I needed to go out into the community as well. So I don't think that it's a bad idea. So if you have to be around other people and you're worried that you might be sick, go ahead and wear a mask because it will help to prevent that from spreading to other people. And if you're trying to protect yourself, then I would wear a mask in that situation also.
And Dr. Felton, we just had some folks join us. So if you don't mind running down one more time for me, just some of the things that you're seeing right now spreading in our community.
I would say that I've seen a couple of cases of RSV, a few cases of flu. I'm definitely seeing more COVID than I have in the last couple of months. The other big one that I've seen recently is something called rhinoenterovirus, and it is a very typical, very common cause of a cold. I'm seeing a little bit of strep also, and this is unique because it's not a viral infection like the other ones are, and this would require antibiotics for most school-age children. Some of these viruses can cause other illnesses like croup. Croup is not the name of a particular pathogen and agent that's going to cause an infection, but it's more of like the symptoms of that like barking cough that children can get that's usually worse at nighttime. So it's kind of a little bit of everything.
All right, so let's try to all stay healthy. And again, if you've got a sick one, it's spreading through your house, not a bad idea to call your pediatrician's office to find out what you should do. Go in for a checkup. It won't hurt for sure. Dr. Felton, anything that I didn't ask you that you want folks to know about today?
Sometimes these illnesses can then progress and cause other complications like ear infections, for example. And so if you have somebody who's been doing okay, but then all of a sudden is presenting with new fever or worsening symptoms, it's another time to check back in with your doctor.
All right, perfect. Thank you so much, Dr. Felton, for your time. Hopefully everybody stays healthy out there. I'm Myra, and sorry. Have a wonderful day.